following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode number 13 of Ask the Behavior Doctors. We're here in Scottsdale, Arizona. My name is Dr. Jacob Boney. I am the owner and clinical director of Scottsdale Pediatric Behavioral Services. We're here to answer all of your questions, give you the best quality info we can about behavioral intervention, behavioral science, and parenting information for children. So today we have questions from parents about the importance or the need of daily routines. In my consultation, I'm brought in to analyze problems in homes and help parents figure out how to smooth things out. And it's interesting because during the intake process, I'll often ask parents, so when am I most likely to see the problem behavior occur? And most parents kind of jokingly or laughingly tell me, we'll come anytime in the morning or anytime at night. You'll see my child do the full-blown show. So what that tells me right there is that's good support. Obviously that routine times, so morning routine, afternoon routine, and nighttime routine are major problems for many of my patients. So the question I got was something like this. I have difficulty getting my kids on a daily routine. What are some things that I can do as a parent to make my kids start taking more responsibility for doing their routines? How can I make this routine thing less work for me and more beneficial and more responsibility for my children? I feel like I'm doing it all wrong. What do I do? Okay. So again, many homes I go into, that's one of the biggest things I see is that children do not seem to know or do not seem to be performing their own routines independently. So here's the rule of thumb is that, the younger the child, obviously, the more they're going to need help completing their routines. But I encourage parents to start transferring control of those routines to the child as soon as possible. And the general rule of thumb is that by the time your child is in school, so by the time they are going to kindergarten on a daily basis, they should have the necessary skills to complete at least 90% of their routine independently, okay? So parents, by that age of 5, pretty critical that we're transferring that responsibility of that routine from you as a parent to that child. And what do I mean by independent routine completion? I mean that your child can literally get up, get dressed, brush their teeth, brush their hair, come downstairs fully clothed, ready, then eat their breakfast, then do whatever fun part of their routine, then get off. I mean, parents, by the time your child is in school, it should not require much work for your child to go through that routine. Now, is this the case in most homes? No, unfortunately, it's not. The case typically looks like this, is that parents are constantly prompting, pushing, prodding. Johnny, get up. It's time to go to school. Johnny, wake up right now. Get your clothes on. Hurry up. Get your backpack together. Where's your homework? Did you put it in your folder last night? It is a hectic, chaotic mess. I would probably say that at least in 60% of the homes I consult with, that routine times are a major problem, meaning the parents are working way harder than they need to. Children are totally prompt dependent on those parents, and that the child is not even close to independently or successfully completing those routines. So let me tell you my reasoning for pushing this routine completion onto children from parents. So just so you know, when I go into homes, I analyze the amount of prompts and the amount of interactions parents have. The average routine time, I have parents who are prompting over 100 times within a 90-minute span during those morning, afternoon, and nighttime routines. The compliance rate during these routine times is sometimes between 20, maybe 50% tops. So here's what's happening is that a large percentage of negative interactions, 60 to 70% of negative interactions I'm seeing in homes occur during routine times, that morning, afternoon, and nighttime. So by transferring control from the parents to the child, so by teaching your child and reinforcing and really transferring that responsibility for that routine, we could get rid of 60 to 70% of negative interaction opportunities just by having your child be the one that's in control of completing that routine. Okay? So number one, it makes you more efficient as a parent because you have to prompt less. You have to be less aversive. You get to be more fun, more reinforcement based when you don't have to prompt your child constantly through routines. Number two, it just eliminates opportunities for non-compliance. If your child is independently completing those routines, well, then you get to get rid of hundreds of necessary or unnecessary prompts every day out of that interaction with your child. So again, it gives them just fewer opportunities to be non-compliant or defiant with you. Number three, I see a tremendous healthy benefit in children who have the confidence and the skills to complete those routines independently. I see that skill transfer. They start doing other things independently and competently. Your children are capable of completing these routines. Most parents tremendously underestimate what their child is capable of. So again, those are three gigantic benefits I see professionally into transferring responsibilities from the parents to the child. All right, so let's talk about how to do this. Okay, so the number one problem is most children have been trained by parents to be prompt dependent. So what that means is they literally are waiting for you to guide them, to tell them next steps to do. They're waiting on you to say, all right, Johnny, you've brushed your teeth, now let's brush your hair. All right, Johnny, you've brushed your hair, now let's put your clothes on. All right, Johnny, let's go downstairs for breakfast. This is exhausting, but again, this makes the child prompt dependent. They're dependent upon you verbally or physically guiding them through the routine. So again, as long as they stay prompt dependent, you're going to be a necessary part of that routine. So we have to transfer what's called stimulus control. You are the stimulus moving that child through that routine. We have to transfer stimulus control from you to something else more sustainable. So what I often like for young children is some kind of visual chart, some kind of visual schedule, or for older children that can read clearly, just like a little check mark board or a check mark list where they can mark off each item in their routine. And you can have from 7 a.m. to 7:05, wake up, brush your teeth, 7:05 to 7:10, put all of your clothes on, 7:15 to 7:20, go downstairs and put your shoes on and get your backpack together. So you can have an explicit schedule laid out. The reason this is important is, number one, I want to eliminate that excuse from the child that, Mom, I don't know what to do. I have no idea what to do next. So this is where the chart comes in, is that the chart can clearly tell them exactly what comes next. Number two, that chart becomes the stimulus that's then kind of guiding and prompting them through that routine. No longer is it you as a parent guiding and prompting them through that routine. Remember, I tell parents this, you do not need to work harder than your child. Your child needs to be expending more effort completing their routine than you do. If you are the one constantly dragging and pulling your child through their routine, that is not sustainable. That is not healthy. That's not appropriate. You're setting yourself up for failure. You're literally just providing too many opportunities to be non-compliant, defiant. You're making yourself less efficient. And then you're not focusing on other areas where you could be providing more reinforcement, more praise, more positive interaction as a parent. So again, we want to, number one, transfer that stimulus control to some kind of visual list. So if a child can't read, obviously I think pictures will be good so that they can tell those pictures are there. And then again, if the child can read, you can just list it. So what I want you to do, by the way, is use that list and say, all right, Johnny, Mommy will talk to you as soon as you're done with steps 1 through 5. So when you're done, come let Mommy know, because then she'll get you your very favorite breakfast item, or Mommy will sit down and talk to you as soon as you're done with these things. Now, obviously, when you're starting this, you need to go through each item on that list and make sure that your child knows exactly how and what to do. You need to teach them step by step exactly how to do each of those skills. If your child doesn't know all parts of the routine, what I want you to do is put all parts they do know at the beginning of the routine, and then save the things they need your help with for the last part. Okay? So let them do everything they can on their own, then come to you for the help. So again, parents, when you're over prompting, just pushing this point home, when you're over prompting, you're making yourself less efficient. By transferring that stimulus control to the list, you reduce tremendously your need to prompt. Remember, effective prompts, parents get effective behavioral responses. So what I mean is everything you say to your child to do, everything you're trying to prompt should occasion or evoke another behavioral response. If your child's constantly not responding to you or constantly ignoring what you're saying, you need to talk less and follow through more. A big problem I see is parents long distance prompt. Don't ever long distance prompt parents, especially for a young child. Rule of thumb is the younger the child, the closer you need to be. If you're not within arm's reach of a child, don't prompt a behavior. Remember, never prompt a behavior you can't either make your child do or enforce an immediate consequence for not doing. No long distance prompting. Inefficiently prompting. So basically using a really long wordy prompt that your child can't even understand, comprehend, or much less repeat themselves. So be efficient. Use very few words, be very direct, and say it succinctly and clearly. I also see parents say way too much of what not to do. Just focus on what to do. Keep conversations short and sweet, but just focus on getting your child through that routine if you're having to start with that initial teaching phase. Don't let it become a battle. It should be fun. It should be light. All right, parents, let's go to the second problem I see. So again, first problem, we transferred stimulus control there. Second problem is that parents tell me, well, Jake, my child constantly seems tired. They constantly seem irritable. They're moody. They're just not pleasant. They don't seem motivated at all to do their routines themselves. It's like they just wait on me to do it. Well, parents, what we got to do here is we've got to manipulate this. We've got to make the behaviors we want as valuable as possible and make the behaviors we don't want as least valuable as possible. So, for example, if you're waking your child up constantly and they're just so exhausted, they're tired, they're begging for sleep, they're not getting out of bed, you constantly have to go pull them out of bed, well, what that may indicate, maybe they're not getting enough sleep. Maybe they're not getting enough quality sleep. It may be something that you need to medically assess and rule out. Parents. So pay attention to those things. Make sure that there's no medical issues sabotaging us. Again, if your child's not well rested when they get up in the morning, that may indicate that they need to go to bed earlier, may indicate that they need to fix some elements of helping them sleep more effectively through the night. Maybe they need to wake up, maybe 20, 30 minutes later. Again, I would consult a professional when kind of making some of those adjustments. But definitely, if you feel like there's a medical issue, get that ruled out with a medical doctor. So let me tell you how we eliminate motivation issues. If we want the child to be rested and we want the child to be energetic, well then make sure they get quality sleep. If we want the child to not be irritable or not be moody, well then don't give that behavior any attention. So remember, make the behaviors we want as valuable as possible. Make the behaviors we don't want as least valuable as possible. If you want the child to get up quickly, get ready, and come to the breakfast table to eat, an awesome breakfast, well then make an awesome breakfast that they really prefer. Provide a really awesome incentive for getting through that quickly and coming to the table. And again, with naughty behaviors we don't like, give it as minimal attention as possible. Tend to the behaviors you do want. Pay attention to the children that are going through their routine, that are doing the things that you want, and save the toughest behaviors for last. Make completion of routines a fun, positive experience that are meaningful and important to your child getting access to the things they want. So this is my point. If Johnny wants to earn extra time playing a game, or wants to earn extra time watching special videos, or wants to earn access to something else he really, really likes, well then make access or all of those things contingent upon completing those routines independently. You know what, buddy? Yesterday you were able to get through only 4 items on your list. If you can get through all 7 items on your routine list this morning, mom will give you access to that thing you really want. So again, making that the bar, making that the criteria to get access to what they want will make that more important to them. I cannot reiterate enough, do not give access to distracting items freely. So this is my point. If I'm in your home looking at the morning routine and Johnny or Sally are sitting on the couch watching TV but not doing their routine, well then you've allowed access to that distractor item for free. Do not do that. Do not ever give free access to reinforcers. By doing that, you sabotage yourself. I've talked about this on other episodes and we can go into it later. But there's no benefit to giving access to reinforcers freely and nothing but costs. So we'll talk about that more later. But again, don't give those things away for free. Use differential reinforcement. What this means is really attune to the behaviors you like, the things you're looking for, and ignore the rest. You get the behaviors you consistently reinforce. So let's say Johnny is being irritable. Let's say he's being a little defiant. However, he's somewhat cooperatively going to the bathroom. He's trying to brush his teeth. Tend to those behaviors. Set the emotional tone, parents. Model the energy you want. Tend to those best behaviors. Push your child through with that positive energy and that reinforcement-based mindset through some of those tough times. Get them through that. Model that mindset that you want your child to have, and they'll be more likely to work through it. Again, make the behaviors we want valuable. Make the ones we don't want not valuable at all. All right, so one of the other problems I see that parents tell me is they tell me that, Jake, I never have any time for myself. I'm constantly with my kids. I mean, I don't have 4 hours to go through a routine. I can't, take 3 hours to put my kids to bed. I need some me time. What do I do? So you really have two options here, parents. You can either get yourself ready and prepared before you start with your children or before you start prompting them or teaching them, or you can wait till the end. Wait till they're all ready and done and accessing their reinforcers, and then do your thing. My advice is I would probably get ready before. I would probably take care of yourself before. Remember, all this is going to require is an initial teaching phase. If you structure a system and allow access to awesome reinforcers once they've done all the behaviors they need to do, your involvement past that should be minimal. I mean, parents, you should not have to work very hard after that initial teaching phase to get your child to independently complete those routines. This should not be a ton of work for a sustained amount of time. So I want you to have that sight in mind. I don't want you to get too overwhelmed in the long term. Just look short term. Teach your child the things they need to know. And then if you set that motivation up and that reinforcement system in place, again, past that, it shouldn't require much effort beyond that. So remember, just tend to the most compliant and cooperative children first. Take care of them first. Do not give the uncooperative children or the unmotivated children any more attention than necessary. So take care of the kids that are most cooperative and compliant first, then save the toughest behaviors and the toughest children for last. Okay? If you know your child's not going to be in the mood to comply or cooperate, what I want you to do, parents, is I want you to just go and then literally just do the routine for them, especially during that teaching phase. I don't want you to say anything. Don't ever talk to an unmotivated child. Don't give prompts and don't have unnecessary conversation. Why? Because you pair yourself with irritability and being non-motivated. That's not what you want to pair yourself with, parents. There is no benefit talking to an unmotivated child. Minimize the attention, praise the good stuff, praise what you can, reinforce the behaviors of what you want, and help your child work through that non-motivated or unmotivated period. Help them step through that. Be positive, parents. Be as positive as possible. Set that tone. Help your child get through that. My advice also is don't start this when you're rushed. Don't start this on a day you have to be at work within the next hour. Start this on a weekend. Start teaching these routines at a time where you have some time to be patient and consistent. Remember, parents, if you stay calm, if you stay collected, if you model that good energy, your children are more likely to react. Make it fun. Make it positive. Make it a game. You can even make it a slight competition. Really, really emphasize that, hey guys, this is important to mom and dad, that you guys be real big kids and you're able to take control of your routines. And you know what, guys? Life is going to be so much better when you can do this for yourselves, because dad and I, we're gonna make it so beneficial. It's gonna pay so well to do this. That should be your mindset, that you're really benefiting your children. You're doing the best thing for them, that this is what healthy, happy children are able to do, is independently complete their routines. Take turns with another parent if you can. Doing so will establish you both as effective instructors. Also, too, doing so will help you both be on the same page, hopefully get a similar result, and will make those results more likely to generalize and transfer to multiple environments. Well, parents, that's kind of a quick and dirty version of that response. Remember, if you've tried some routine modifications before and haven't had any luck, my advice is consult a professional. Get someone to come in and analyze what's going on, and just some minor tweaks sometimes can make a drastic difference. So parents, I encourage you to seek that help if you feel like the things you have tried before, especially beyond some of these recommendations, maybe haven't worked as well as you're looking. So parents, I want to thank you That brings us to the end today. I want to encourage you to please continue submitting your questions to us here at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. We want to thank you again for submitting those questions to us here at Scottsdale Pediatric Behavioral Services, and ask the behavior doctors.